Thank you for listening to Life Improvement Radio. You are listening to a rebroadcast of a previously recorded show.
All right, back to you, Casey, as we're live from the Miami Book Fair. Number 5 is interesting, and to say the least. And, Casey, are you back on the line?
Yes, I am, yeah.
Okay, so, Casey, I guess you'll have to hook up and plug in, but this might be an easier way to do it. You know what I mean? You can become my co-host today till tomorrow, and we can figure out the logistics tomorrow with Life Improvement Radio or myself. Who knows? But I've learned in this business and doing X amount of shows a year, Casey, that this is just how it is. This is all part of the plan. And, hey, at least you can tell me who's coming on the next line and give it a little background. And, hey, you're going to get yourself out there as well, and maybe have to put you in the bio for today, Casey. So, who do we have on the line next?
Coming on next is Mr. Jeffrey Lieberman.
All right, well, fantastic. We're going to go ahead and welcome Jeffrey Lieberman to the show. I'd like to welcome the program Jeffrey Lieberman. Jeffrey, thanks for calling, and how are you?
I'm fine. How are you, Neil?
I'm doing fantastic. A little bit of a logistics issues at the beginning of the day, but now I'm happy, and that's what always going live is for sure. And I'm sure when you decided to write your first book, it probably that same process came into place, going out of your comfort zone, correct? And writing books.
Absolutely. I thought I was going to be able to knock this off in like 3 or 4 months, and it took me almost 2 years.
Well, especially as a bright person as yourself with your education background and things, you think, writing a book, look at all the different research you've done in your career and all these different things, but then writing a book, different story, isn't it? So, yeah.
Well, yeah. I mean, I thought I could write it pretty much off the top of my head with doing a limited amount of research, but what happened was my editor, thankfully, beat me up and said, look, none of this turgid academic prose. You got to make this thing interesting and engaging. People have to, in the first chapter, have to be really hooked into the book and want to keep reading. And so, it wasn't so much, what the ultimate arc of the book was, but it was really making the sequence and the contents of the book flow and, gain momentum, and also embellish it with stories and personal accounts to draw the reader in and make them be able to relate to it.
Well, it's interesting. As a psychiatrist, Dr. Jeffrey, I'll bring it up to Dr. Jeffrey. Me as the educator, I always like to bring that up for our listeners out there, that really psychiatry is misunderstood. And especially with what's happened with our mental health system in the United States in so many ways, a book like this is really needed. Because with just the different tragedies of people committing suicide, to mass shootings, to the amount of people that are on medication for depression and anxiety, you need to kind of explain what you do, and also looking at particularly enough what to look out for. Am I correct?
Oh, absolutely. I mean, the media really focuses on, and the public hears about, what you're saying, kind of the glaring social pathologies which occur as a result of inadequate mental health care. So it's the mass violent incidents, it's the homeless people in the street, it's the increasing number of people with mental illnesses who are in jails, it's the increases in domestic violence and addiction, the unchanging or in some cases increasing suicide rate. But those are the tips of the iceberg. The reality is that if we had an effective public health initiative on mental illness, like we have had on other things in the past, infectious disease, cardiovascular disease,
yes,
environmental toxins like smoking and lead and asbestos, not only would those things be diminished or eliminated, but the overall quality of life, the cost of delivering health care, medical, surgical, would be diminished. But for whatever reasons, mental illness is stigmatized, psychiatry is mistrusted, and the politicians and the policymakers just don't get it.
Amen. I have a client, and she lost her son, and one of the things, I do social media and branding for companies, and one of the things we're doing is trying to get that message out to the masses. Suicide prevention, different things that we need to train people to get healthy. their brains healthy. We get our bodies healthy. We try all these different things to become intelligent in this world, yet we're not looking at the mental health concerns at an early age.
That's
and
right.
Looking at all of those different things. Expound on that, and I want to get to the book, but I can tell you and I are going to have a great conversation today on Live from the Miami Book Fair.
Yes, exactly. And in terms of what you were saying, there needs to be, in that context, a particular focus on youth, because youth is the sweet spot for mental health or mental illness.
Yes. And let's touch upon that. I don't know if you've checked out my background. I have taught for 9 to 10 years. I own a tutoring and consulting company, and I see flat out how important the child is and how important it is for us to be concerned about their mental health at an early age, because from bullying to different circumstances in the home, they can really affect their entire lives, can't they, based
Absolutely.
on bad circumstances? Yeah.
I mean, except for the dementias and to some degree addiction, the majority of mental disorders have their origins either genetically or in early development. And also the majority of mental disorders begin to manifest their symptoms earlier in life rather than later in life. So not only can you sort of nip this in the bud, but you can prevent these things from occurring if you're attentive. So, I mean, just from a practical standpoint, the first thing that could be done with great benefit would be to introduce a much more sophisticated level of screening for early identification in primary care systems like pediatricians' offices, OBGYN
Yes.
Offices and clinics, and also in the schools, in the school system. But not the kind of thing that we have now where if a kid has a learning disability, they get trotted off for testing and then treatment with Ritalin, but that they get some kind of remedial education evaluation, but then they get the kind of emotional support and cognitive retraining that they may need, or referral to a mental health care provider to treat whether it's incipient anxiety disorder, depression, trauma from an abusive household, or whatever. And all these things begin early, and then they sort of progress and fester. And if they're not treated, I mean, if you look at just the incidents of mass violence that have occurred over the past several years, a disproportionate number of them were perpetrated by young men with mental disorders that were symptomatic for months or even years before they committed their crime, and they were not adequately treated.
Exactly.
It's ridiculous.
It's absolutely ridiculous. And then the warning signs, that's the biggest problem. I mean, I dealt with situations where I was concerned about one of my students and the issues, and I said, hey, these are big warning signs coming up. With Mom, you need to contact as quickly as possible, get him admitted, and don't wait. And then why we have not come up with laws when we know that they're a danger to someone, themselves or others, to be able to get admitted earlier and not just expect them to be out on the streets when they're a danger to themselves or others. That's
a big part of it is the recognition and encouraging or enabling parents or responsible others to act by seeking help. The other is making it accessible to them, because oftentimes it's just not accessible. There's this story that got a lot of media attention about a year and a half ago. Virginia State Senator Craig Deeds has a 24-year-old son, Gus, who was floridly psychotic with bipolar illness, and he was desperately trying to get him hospitalized, and he couldn't find a place that took his insurance or had him in bed, so he took him home, and his son attacked him, slashing him with a knife in his face, and then committed suicide. I know this because not from the media, but I testified before Congress with Senator Deeds on that thing. But you see a countless number of times. I've consulted defending WPIC in Pittsburgh on cases where they were called by family members to help with a family member, usually a adolescent or a young adult child who is out of control, manifestly ill, but their hands are tied if the person won't voluntarily agree to come into the hospital or receive treatment, because our civil liberties emphasize the right of the individual to refuse treatment unless they're overtly dangerous.
Absolutely, and it's something that we have to do. And you've heard certain politicians wanting to change the laws so that it's protected. That I guess the privacy of young adults, in a way, parents can be informed now more and different things. What are your thoughts on that situation where they're looking at more? Yeah.
I'm absolutely supportive of it and in favor of it. I mean, the general principle that needs to be understood is that, in our country we emphasize the right of the individual even to the extent of limiting the rights of society. And I think it's gone too far when it comes to mental illness. And actually, your part of the country is really, I think, in the leadership role in this regard, because you have a congressman, Representative Tim Murphy, who himself, by background, is an educational psychologist, and he's introduced the most important piece of legislation in Congress since the Mental Health Parity and Addiction Equity Act, and he's been struggling to get bipartisan support. But Tim Murphy, in my opinion, is a real hero and the most important champion of mental illness and health care right now in Congress.
And what's very interesting about Tim Murphy, Congressman Murphy, and I'm hoping that the opportunity I get to interview him. It's funny where I'm broadcasting today. Good friends, someone's very good friends with Congressman Murphy, and hopefully he's going to come on my program. Is that let's get this passed. Let's have this happen, because maybe some of these mass shootings, suicides, are going to be prevented. And your book, Jeffrey, kind of delves into the history of this to look at how we used to treat certain psychiatric disorders, correct? And how it's changed, yet you want it to continue to evolve to be better for the patient and the family members and people in society that are dealing with these brain diseases. This is the thing we have to understand. It's a disease that can be treated but yet cannot be cured, correct?
That's exactly right. I mean, I've been in academic psychiatry for 30 years and doing mostly research and treating people. But I wrote the book because I was really frustrated by the stigma and misinformation and the lack of an effective mental health care policy in this country. And what I found, or what I tried to communicate, was that a lot of the inaction and misunderstanding and stigma comes from two things. One is that these illnesses have been very mysterious because it's been hard to understand what their origins are, and if it is from the brain, where in the brain. But the other thing is that in the course of healthcare and doctors trying to learn and treat these things like they do everything else, heart disease, cancer, pulmonary disorders, psychiatry hasn't acquitted itself too well. We've not really come up with great theories. We were totally enthralled by Freud for a long time, and a lot of the treatments that were used on the most severely ill people, like lobotomies and coma therapy and malaria treatment, seem pretty barbaric. So the public and the government have some residual skepticism and mistrust. So the book really intended to start out by fessing up and trying to make people understand that was then, but now is now, and it's the game has changed and it's totally different.
Right. The game is totally different, and we have to figure out these things. One of the biggest concerns, Jeffrey, I have is, again, the bullying aspect of kids dealing with bullying in the schools and then committing suicide because of cyberbullying and different things. Do you have any recommendations for how families should deal with this, especially when they might be concerned that their child could have some issues? What are some warning signs to say, okay, we need to possibly specifically contact a professional so that we catch this early enough that it doesn't become something that leads to suicide, to cutting and suicide?
Right. Well, bullying is not new. It's existed throughout history, and kids will be kids. So on one hand, you don't want to encourage it, but on the other hand, you're not going to be able to completely prevent it.
Right.
Most bullies tend to come from abusive households or households in which that kind of behavioral dynamic is prevalent. In terms of the victims, I think, what we've seen as our society's evolved and become more modernized and sophisticated is a diffusion of responsibility, which used to pretty much roll up to the family. That is, taking care of the kids completely and taking care of the elderly when they got sick, so forth. But it's been diffused in terms of who's responsible. And the school educational system, through college, has been asked to take on more of this responsibility. So we have student health services, student mental health services. If families aren't able to understand how their child is being affected by the social environment in their schools, including if they're targets of bullying, then society, government has to figure out who else can provide that. And probably the best place to locate it is in the schools. But if not, then maybe in a very accessible healthcare system that provides mental health care, which parents can be directed to. But I would favor having more of a mental health presence in the schools. And on one hand, it would deal with things like learning disabilities and depression, anxiety, drugs. But on the other hand, if kids are showing the behavioral effects of bullying, that can be a source of support and assistance to them. On one hand, they could become aware of the fact and try and stop the bullying. But beyond that, it would provide them with support and teach them how to handle this kind of abuse and also develop a sense of resilience. Because throughout life, people are going to have to cope with adversity and physical or sort of mental threats. And you want to teach a child how to cope with these kinds of things. Whether it's a boss who's abusive or whether it's a spouse who's. So it can start early in school. So I think that provides really the best venue.
Definitely, I agree. Where's the best place we can find information on you, Jeffrey? I definitely am glad the call to action. We need to transform our mental health system, how we take care of people with these issues, and we need to get more therapy for people. We have to have a more early identification, and we need to have better support for the whole group in general. But where can we purchase your book and learn more about you, Jeffrey?
Yes. Well, I would love for people to take a look at the book. I think it is a good read, but at the very least, it'll help you get to sleep at night. And apart from that, I would say the Murphy bill, which you can find easily on the website, it's H.R. 2646, that's the bill number, is a really good primer, and that would really be an important step forward. Beyond that, former Congressman Patrick Kennedy, in his post-congressional life, has begun what's called the Kennedy Forum, which is an advocacy organization for mental illness and addiction, which is a very good source of information. And the final thing I'll say about this is that because there's really we're lacking a really superior quality kind of policy research entity like the RAND Corporation or the Brookings Institute or the National Academy of Medicine that focuses on mental illness. What I've been doing in my spare time is putting together the sort of blueprint for what would be a policy research institute on what we're calling brain behavioral disorders at Columbia University, to be able to draw on the intellectual resources of experts within the university and around the country to formulate policy on issues relating to domestic violence, to violence among the mentally ill, to homeless, to treating addiction and comorbid mental illness that the government or other funding sources could rely on for really the best quality science and information that we have on how to sort of make laws or make policies.
Well, tremendous, Jeffrey, and you also purchased your book on Amazon and stuff like that, and they can Google you to find more information and all that stuff. I appreciate you coming on the show, and I will mention when I have Congressman Murphy about what you're doing as well, and saying that I've had people that have told me this is the best thing for us to do to change the way we treat mental health in this country. So I thanks for calling, and I appreciate it.
Thank you, Neil.
All right, just pass the note back to Casey.
Thank you for listening to Life Improvement Radio. The views expressed by show hosts or their guests are their own and shall not be construed in any way as advice from Life Improvement Radio. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our website. Personal perspectives expressed by the producers, writers, or editors will always be presented as such. Any rebroadcast or retransmission without the expressed written consent of Life Improvement Radio is strictly prohibited. Thanks for listening.